Well, it is the first full week where no coronavirus deaths have been reported in Scotland. And outside our three major cities, there are fewer than 10 confirmed cases in hospital. Nevertheless, the NHS in Scotland continues to be on an emergency footing and is only in the early stages of resuming some planned operations. This will have an impact on waiting times for thousands of patients. Our health correspondent Lisa Summers visited Forth Valley Hospital in Larbert to see the efforts they're making to catch up with the backlog.
You all right to do a wee blood pressure? All right.
Phyllis is having thyroid surgery today. She feels quite safe visiting the hospital.
Everything's been signposted and you walk on the footsteps, keep to the left, and everybody's explained everything beforehand and told me exactly what to do.
But it's not business as usual here. This would normally be the day surgery ward, dealing with routine procedures. But it's taking in patients where doctors feel their need for care is a priority.
We didn't know how the virus was going to go.
Drew has also been brought in quickly. A break in his treatment for cancer means a window to carry out surgery on his hip.
I'm just lucky I got it done, I suppose. A bit of pester on the surgeon as well, I think, because I have been in a bit of pain in the last 3 or 4 months. I can hardly walk. It's been that bad.
Forth Valley has managed to restart around 50% of planned operations. Clinicians whose work had been paused because of the pandemic are now reviewing their waiting lists.
We went into COVID with a little bit of a backlog, so we're not going to come out of it without being able to catch that. But we're looking at all opportunities. We're exploring seeing patients at the Louisa Jordan. We're doing clinics and GP practices. We're using all of the resources that we have available to us, both to try and keep up, but also to try and get a bit ahead of ourselves.
The hospital remains flexible in case the virus sees another increase.
We're taking each day as it comes and feeling very positive. Everything at the moment is just getting booked sort of 2 to 3 weeks in advance so that we have the ability to, scale things back again should anything happen.
Although the risk of infection from COVID is now low, additional safety measures have been put in place in hospitals.
Normally we would be in this room with the patient and my assistant, and we would put them to sleep here. We need to do everything inside, so patient and everything starts inside. We put them off to sleep in full protective equipment. Then we need to allow a bit of time to pass, so 6 minutes for the air changes to happen before the rest of the staff are able to enter theatre and start getting ready for the rest of the operation. So add some delays, and we're doing the best we can to minimise those delays, but they're unavoidable to some extent.
Phyllis self-isolated for 2 weeks and tested negative for COVID before coming to hospital.
Because Phyllis is having thyroid surgery, she's had a general anaesthetic, and that's meant that the staff have had to clear the room to let the air change completely, just in case there were any contaminated particles. After the surgery's finished, they'll do a deep clean, and all of that has an impact on the number of patients that can be seen every day.
Oh, you get me, Peter.
Getting things underway is good news for lots of people, but others will have to be patient. Lisa Summers reporting Scotland, Forth Valley Hospital.
Cheers, Elaine. Bye.
It's emerged more than 60 agricultural workers bound for Scotland were on the same flight as the workers who tested